Mandatory nurse-to-patient ratios has been a contentious topic in the state of New South Wales. However, whilst this contemporary nursing issue continues to be debated upon, we must look beyond figures and focus on leadership within these nursing environments. In particular, how emerging leaders such as undergraduate nurses can be the pioneer in ensuring patient safety and maintaining a healthy workplace. My name is Imogen and I'm a third-year student, also soon to be a graduate nurse, and I'll be presenting the contemporary issue of nurse-to-patient ratios, how new graduate nurses can use leadership to positively impact patient safety and a healthy workplace. This presentation is targeted towards Bachelor of Nursing students as well as new graduate nurses within their first year of their job. The following presentation will explore the significance of nurse-to-patient ratios, including why it's a problem and what is being done about it, the responsibilities of new graduate nurses when encountering ratio issues, including scope of practice, legal and ethical boundaries, and most importantly, how emerging graduate nurse leaders can mitigate the problem of ratios through leadership. This discussion has been communicated through this medium of a PowerPoint presentation as an appealing mode of learning for those who are visionary or auditory learners. It also provides the viewer the chance to pause this presentation, to take notes, or to reflect on their thoughts and experiences. I would also like to recognise that this presentation is made up of a culmination of recent journal articles, New South Wales government policies, as well as significant organisations including the World Health Organisation and the Australian College of Nursing to make an informed discussion on how graduate nurses can be leaders in this contemporary issue of nursing. Mandatory nurse-to-patient ratios has been proven by evidence-based research that it is significantly effective in upholding quality patient safety as well as contributing to a healthy workplace environment. In New South Wales, nurse-to-patient ratio is not mandated, thus leaving gaps in healthcare and jeopardising the welfare of not only patient safety but staff's. Inadequate nurse-to-patient ratios has been found to negatively affect patient safety. A recent study conducted in 3 major tertiary hospitals in Perth, Western Australia, found that there was a relationship between increased falls, medication errors, and pressure ulcers due to ratio issues. Additionally, negative patient feelings, such as feeling not important or a lack of care or empathy given by nurses, was found to be felt by patients, as well as patients feeling that nurses did not have time for them due to an increased workload. Not only has inadequate ratios been found to contribute to poor patient safety, it has also impacted the well-being of staff in maintaining a healthy workplace. A study conducted in 2014 on all Californian hospitals investigated the number of injuries undergone by registered nurses before and after their mandatory minimum ratio laws were implemented in 2005. It was found that there was a significant reduction of injury rates and illnesses by 31.6%, strongly suggestive due to the change of law. Additionally, Dawson found that nursing satisfaction greatly increased, as well as a reduced nurse burnout and stress due to implementing mandatory ratios, leading to a healthier workplace. Overall, inadequate nurse-to-patient ratios caused moral distress amongst nurses and felt less satisfaction in their working environment due to their team's collective stress. This topic is particularly significant in contemporary nursing, as we are going to be seeing a projected increase of admitted patients in hospitals. The World Health Organization estimated that between 2015 and 2050, that the world's population of people over 60 years old will nearly double from 12 to 22%. The CSIRO further cements this population boom by signifying the impact this will have on hospital admissions. leading to increased patient loads and nurse pressure if no mandatory minimum ratios are in place. Additionally, they emphasised that the existing and emerging challenges of increased patient load will see more ageing patients coming through hospitals, as well as an increase in chronic illness rate. Currently, in the state of New South Wales, the New South Wales Nursing and Midwives Association lodgement request to the New South Wales Government to introduce mandatory minimum nurse-to-patient ratios was rejected. Thus, the New South Wales Health principles of rostering remain the same, with their objectives including to ensure that rosters are sufficient and that there are appropriately skilled rostered staff to work. As we can see, not a whole lot is being done to solve this issue in New South Wales. Therefore, exploring other alternatives such as how new graduates can be leaders in mitigating this problem will be explored. But firstly, let's break down what it means to be a leader or to have leadership qualities. The Australian College of Nursing details leadership as an individual of being able to positively influence others to achieve goals by providing support, motivation, coordination, and to enable people to work towards positive change. They also highlighted that anyone can be a leader, including new graduate nurses. A study by Dawson found that nursing leadership is critical for implementing evidence-based practice, promoting optimal patient outcomes, and optimizing the value of healthcare within ethical frameworks. Its importance is particularly relevant to this issue of tackling nurse-to-patient ratios, as leadership is a non-financial incentive that has been found to improve staff well-being and work satisfaction. Additionally, nursing leadership was also found to be one of the major correlating factors that contributed to a reduction in missed nursing care and increased patient safety. Regardless of whether you are a graduate or senior registered nurse, it is an expectation for all registered nurses to exhibit clinical leadership. This is reflected in the Nursing and Midwifery Board of Australia's Registered Nurse Standards for Practice. Standard 2.8 highlights that nurses must participate in and/or lead collaborative practice. The standards of practice also reflect in point 6.1 that they must provide comprehensive, safe, quality practice to achieve agreed goals and outcomes that are responsive to the nursing needs of people. Registered nurses aren't only expected to be a leader to implement patient safety and positive health outcomes, they're expected to abide by a number of regulations and professional standards. In New South Wales, nurses are governed by the New South Wales Health Code of Conduct, the 7 Registered Nurse Standards for Practice, the International Council Nurses Code of Ethics, as well as all policies relevant to their specific hospital. These professional, ethical, and legal requirements ensure a high-quality standard of care is facilitated in New South Wales by defining the duties and obligations of the registered nurse, their scope of practice, and professional boundaries. To be able to uphold these requirements, to practice safely, and to be able to work independently, nurses must practice leadership to provide positive patient outcomes. It is important to note that it is not abnormal for new graduate nurses to be scared or anxious entering upon the clinical environment, especially having to consider the thought of being a leader. However, as highlighted by Davidson, it is never too early to focus on developing your leadership style, beginning to critique others' leadership styles, and preparing to transition from being a student to a registered nurse. Additionally, graduate registered nurses are already perceived as emerging nurse leaders, whether they know it or not, and it is important that they utilize their emerging leadership skills to successfully carry out safe patient care. So, how can new graduate nurses positively impact patient safety and a healthy workplace through leadership? Well, firstly, new graduate nurses can stand up for themselves or others when recognizing if a particular patient load is unfair. Although moral courage is difficult, it demonstrates not only strong leadership qualities, it also upholds Standard 6 in the Registered Nurse Standards for Practice to provide safe, appropriate, and responsive quality nursing practice, as well as Standard 5.2 of collaboratively construct nursing practice plans to create shared goals. Finally, another leadership approach to counteract poor nurse-to-patient ratio would be to suggest to the team leader or nurse unit manager to utilize a team nursing approach if not already used. Team nursing is a collaborative approach where two nurses work together and share a workload. This model is successful in increasing patient safety as well as ensuring nurses are working collaboratively to achieve shared goals for patients. In summary, graduate nurses are seen as emerging nurse leaders and must enact leadership values to ensure patient safety is maintained when poor nurse-to-patient ratios arise. This will in turn result in a healthier workplace for nurses working in acute care settings. Thank you.